Welcome to Chapter 14, Protecting Against Infectious Diseases and Sexually Transmitted Infections. While infectious diseases they're no longer the leading cause of death that they once were, it's still really necessary to have an understanding of the process of infection. And an understanding that adequate sleep, proper nutrition, exercise, and good hygiene can really help in building resistance to colds, flu, and other diseases, infections. We're going to discuss sexually transmitted infections as well, STIs. And there will be some graphic content, so that's just your forewarning. And we're going to look at HIV and AIDS as well towards the end. And kind of understand how we can break some cycles of infection. Okay? Most infectious diseases are multifactorial, or they're caused by an interaction of several factors inside and outside of the person. Three factors, three conditions really need to take place, called the epidemiological triad of disease. Must be met. So first, the host must first come into contact with a pathogen, which is the infectious agent that is able to overcome the body's defense. The host must be susceptible in some way, vulnerable to infection. That is, the pathogen must be virulent enough to overcome a healthy immune system. Strong enough to overcome the healthy immune system. Or as in a case of opportunistic infection, the immune system is weakened, is in a weakened condition, immunocompromised. The environment must be hospitable to the pathogen, meaning a good place for the pathogen to live in terms of temperature, light, moisture, other requirements. An epidemic, it's a disease or an outbreak that affects many people in a community or region at the same time. And a pandemic, which we are experiencing firsthand, it's a global epidemic of disease. So an epidemic is more contained. So if it would have been in just one country, it would have been an epidemic. But now that it is global, it is elevated to pandemic, what we're experiencing currently. So how do pathogens gain entry or routes of transmission? Pathogens can be transmitted through direct contact or by indirect contact. You can also auto-inoculate yourself or transmit a pathogen from one part of your body to another. Something known as hand, foot, and mouth disease in babies. It travels, babies have a tendency to put their hands and their feet in their mouth, and so they get a disease that is auto-inoculate. Some other diseases are auto-inoculate as well. Dogs, cats, livestock, and wild animals can be the source of animal-borne or zoonotic infections. By spreading disease through bites or feces, or by carrying infected insects into living areas. Interspecies transmission can occur. It's rare. Vaccinations help with that. Basic hygiene and care in contact with animal fluids are really important as parts of prevention. There are some things that you can do to eliminate, reduce, or change your susceptibility to various pathogens. Being mindful of your stress levels, looking at your diet, your fitness level, lack of sleep, misuse or abuse of drugs or alcohol, poor personal hygiene, and high-risk behaviors significantly increase the risk for many diseases. So here is a look at the routes of transmission So our first is contact, either direct or indirect. So either skin or sexual contact, or indirect, infected blood or bodily fluid. Taking a drink from somebody else's glass when they have an infection, and they have left saliva on their glass, and then you taking, that's an indirect contact with bodily fluid. Foodborne or waterborne, eating, drinking, washing, and unsanitary food preparation. That's typically when when water is not clean in many places. You see a lot of infection. Airborne, infection spread by inhaling droplets from an infected person sneezes or coughs, which is what we're experiencing currently. Vector-borne. This is blood-sucking insects like mosquitoes, fleas, ticks, flies. They pass along pathogens when they bite their human victim. So when the insect bites, it's once they are passing that secretion because they've bitten one person to the next. And then perinatal, similar to contact infections, that happens in utero as the baby passes through the birth canal or through breastfeeding. So multiple ways for routes of disease transmission. There are some risk factors that are more difficult to control. That's heredity. If that is in your genetic makeup, that you have a genetic predisposition. Age is attributed to risk factors, environmental conditions, and then the organism virulence or its resistance. So how strong the organism is, the pathogen. Some of them are just so much stronger than others that it's like the Incredible Hulk of viruses, and it just kind of takes over. Our body does have defenses against infection. And for pathogens to gain entry into the body, they must overcome multiple effective barriers. Skin, enzymes in body secretions, internal linings of the body. We've got visceral linings of our organs, and immune system defenses. So we have a look here of what our body is capable of. So our skin provides a physical barrier to the entrance of pathogens. We have an acidic pH, which discourages microbe growth. And our sweat and our oil glands secretions kill a lot of bacteria. A lot of our own personal bacteria fights off. Our good bacteria fights off bad bacteria. Tears, they wash away irritants and microbes from the eyes. Saliva washes away those microbes from the teeth and mucous membranes of the mouth. Our respiratory tract, nasal hairs filter and trap microbes. Mucus traps microbes. We want that mucus. The cilia sweeps away debris. In our stomach, the acid kills pathogens. Not a whole lot can actually survive that stomach acid. The large intestines, there's normal bacterial inhabitants which keep invaders in check. So gut health is really important, and maintaining levels of bacteria in our gut is really important. The urinary tract washes away microbes from the urethra. So after, for women especially, it's really important after sexual intercourse to urinate, because you need to wash out microbes that have come in. Our blood and our lymph nodes, macrophages destroy pathogens. Natural killer cells attack and destroy virus-infected or abnormal body cells. Our lymph system is so important with helping with inflammation, and it's where a lot of toxins are stored. And while our lymphatic system is really important in that aspect, there's no pump for it, and sometimes things kind of get stuck and congested, and they'll get stuck in like the glands. We'll get swollen glands. and such. So we're going to do a couple of exercises in class that help our lymph system, and it will improve our immune system overall. Actual fevers are actually a really good thing for our body to a certain degree. We don't want them to get too high, but they inhibit multiplication of pathogens, and they actually accelerate tissue repair by heating our body and making our body move those things faster. We have specific immune responses. B cells produce antibodies in response to specific antigens. Human immunity. T cells attack and destroy foreign cells, or cells that have been infected by foreign antigens. Memory cells remain to mobilize quick response to future invasion by the same pathogen. So our body really does have a lot of adaptive responses to disease-causing pathogens. Immunity is a condition of being able to resist a particular disease by counteracting the substance that produces the disease. Any substance capable of triggering an immune response is called an antigen. The body's response to an antigen is the formation of antibodies. Humoral immunity is the body's major defense against many bacteria and the poisonous substances called toxins that they produce. In cell-mediated immunity, specialized white blood cells called lymphocytes, they attack and destroy the foreign invader, the foreign substance in the body. Lymphocytes are the body's main defense against viruses, fungi, parasites, and some bacteria. They're found in the blood, the lymph nodes, bone marrow, and certain glands. Okay, so here's a diagram of cell-mediated immune response. So our first thing that happens is an antigen invades the body. It breaks through one of the barriers. Number 2, T cells recognize that they've been invaded, and that triggers the killer T's and the B's to get to work. Number 3, the killer T's destroy the infected cell, and the B cells produce the antibodies. Okay? Up to 4, when the threat is over, the suppressor T cells stop the activity of B cells, killer T cells and macrophages. Memory B and T cells are reserved so the body can respond quickly to future antigens in the same, future attacks by the same antigen. So now I've built immunity because my body is going to remember how to do this with this particular attack and this particular antigen when it invades the body again. So although the immune system response generally works in our favor, the body sometimes makes mistakes and targets its own tissue as the enemy. This is known as an autoimmune disease. Common autoimmune disorders: rheumatoid arthritis, systemic lupus, type 1 diabetes, celiac disease. So that's people who have a true gluten intolerance typically have celiac, and MS. Inflammatory response, pain and fever, there's really 4 typical signs of inflammation. That's redness, swelling, pain, and heat. Fever is another indication of inflammation. High temperatures can destroy some disease-causing organisms. So again, the fever is good to kill off some of what's going on. But we want to make sure it doesn't get too high because it can also kill off the healthy cells. And also there's a stimulation for more white blood cell production when fevers are present. Vaccination is based on the principles that once people have been exposed to a specific pathogen and experienced a successful immune response, subsequent attacks will activate their immune memory, the diagram we just talked about, and allow them to fight that pathogen in the future. Vaccines consist of killed or weakened versions of disease-causing microorganisms, typically given orally or by injection to cause the body to develop that immunoresponse against the organism. Artificially acquired active immunity is gained by vaccination. Specific vaccination schedules have been established for various populations or groups. And so you've gone through this when you've gone to school. You have to have certain vaccines up to date. Some countries traveling out of our country into other countries, especially third world countries, there's other diseases in those spaces where we need additional inoculations. So here's a close-up look of some of the major types of pathogens that invade our body. We've got parasites, bacteria, viruses, fungi, protozoan. Those are just an example, and those get inside of our body and attack, and our body then develops that response for the immune building. So bacteria are single-celled organisms. Three main types are cocci, bacilli, and spirilla. Diseases caused by bacteria are often easily treatable with antibiotics. Antibiotic-resistant bacteria, or they're also called superbugs, result when successful generations of bacteria mutate to develop resistance to specific drugs. This also happens if we take antibiotics too often. Antibiotic and antimicrobial, easy for me to say, resistance is actually one of the world's most pressing problems. Staphylococcal infections, staph, or MRSA, they're present on the skin or in our nostrils of 20 to 30% of us at any given time, and usually don't cause a problem. The presence of bacteria on or in a person without infection is called colonization, right? You have bacteria living on you all the time. Acne, boils, STIs, infected wounds are examples of staph infections. Methicillin-resistant staph, otherwise MRSA, it's really dangerous, and it is a resistant form of staph, so it's not, is really resistant to medications, and it causes a lot of complications. Healthcare associated or healthcare acquired MRSA is contracted in healthcare facilities, hospitals, nursing homes, or clinics. And those are some of the leading healthcare associated infections, HAIs. MRSA today is on the rise between family members in the home and in workplace and communities. So it's known as community-acquired MRSA. C. diff, it's a bacterial disease that leads to major inflammation of the colon. Long-term antibiotic use is a culprit because it kills the good bacteria in the gut, so it's a major cause, and elderly are particularly at risk for this. Streptococcal infections, there's multiple, and at minimum we get like strep throat, maybe scarlet fever, neither really pleasant at all. The one virulent type of strep is actually necrotizing fasciitis, and it's flesh-eating strep. There's also strep that leads into pneumonia. Meningitis. There's two types. There is a more virulent form, which is prevalent actually on college campuses, and it's among the most serious. And this affects membranes that surround the brain and the spinal cord. Bacterial meningitis progresses rapidly. It's life-threatening and needs immediate medical attention because it's having to do with the brain. So anything that's having to do with the brain, which is our motherboard, we want to, like for our body, we want to get that taken care of like ASAP. It requires immediate attention. Signs of meningitis are a sudden fever, severe headache, stiff neck, particularly causing difficulty touching chin to your chest, right? Doing kind of like that. There are vaccines for some type, and so viral meningitis is less dangerous, and symptoms usually diminish in 3 to 5 days in typically healthy people. Pneumonia is a general term for a wide range of conditions that result in inflammation in the lungs and difficulty breathing. It can be bacterial, viral, fungal, or caused by occupational exposure to chemical or trauma. Bacterial pneumonia is readily treated with antibiotics, really easily treated. Tuberculosis, TB. Only HIV/AIDS is a greater infectious agent killer than tuberculosis in global populations. Symptoms include wasting away, like weight loss, persistent coughing, fever, spitting up blood. It was historically known as consumption, like the infection consumes the person. Airborne transmission via the respiratory tract is a primary mode of infection. So TB is something that people are tested for on a regular basis as they're older, especially if you're working with people. When I worked in medical facilities, I was tested for TB annually. TB, there's a multi-drug resistant TB that is currently resistant to at least 2 of the best anti-TB drugs in use today. There's extensively drug-resistant TB, and it's resistant to like all first and second line drug defenses against it, and it's extremely difficult to treat, which is why we test it all the time, because the sooner we find these things, the more the more we can treat them, the sooner we know. There's tick-borne bacterial diseases, which are becoming more and more prevalent and become a major health threat in the U.S. And one of the major diseases from that is Lyme disease that we get from ticks. And that causes a number of neurological problems. Symptoms of Lyme disease range from really none to a rash, bullseye lesion, flu-like symptoms, to chronic arthritis, blindness, and long-term disability. Preventive measures include staying out of the woods or grass during times that ticks are most active, using insect repellent with DEET, which also has a host of other concerns that go along with that. Wearing long sleeves pants and doing tick checks, making sure you don't have ticks on you. And we have E. coli. It's a foodborne illness that causes severe bloody diarrhea and kidney failure. Causes of the infection include undercooked ground beef, unpasteurized milk or juice, or swimming in sewage contaminated water. Viruses are the smallest known pathogens, and they're incapable of carrying out any life processes on their own. To reproduce, they have to invade and inject their own DNA and RNA into a host cell and force it to make copies. Viral diseases can be really difficult to treat because many of them can withstand heat, formaldehyde, and large doses of radiation with little effect on their structure. Some viruses have incubation periods, and that lasts for years, which delay diagnosis of the disease, and drug treatment for viral infections is also limited. The common cold is an example of a viral infection, and 10 to 40% of all colds are caused by rhinovirus. 20% of colds are caused by coronavirus. The coronavirus is not something that's new. Colds are endemic. They're always present throughout the world and increase in prevalence when the weather turns cold and people spend more time indoors. Influenza or flu is a contagious respiratory illness that includes fever, chills, along with other cold symptoms. Once a person gets the flu, treatment is focused on the relief of the symptoms rather than a cure. The best way to avoid the flu is to get the flu vaccine. I think it's being offered here in school this week. Flu shots take 2 to 3 weeks to become effective, so people at risk should get these shots before the season begins. Hepatitis is a virally caused inflammation in the liver, and symptoms include headache, nausea, loss of appetite, skin rashes, pain in the upper right abdomen, dark yellow urine, and jaundice, like the person actually turns yellow, which is what jaundice means. There are several known forms, A, B, C, D, E, with A, B, and C having the highest rate of incidence. COVID-19, why we're hearing so much about that, obviously right now we're experiencing a global pandemic. And it's called novel coronavirus. Novel meaning new. It's a new coronavirus. So coronavirus has been around for a really long time. We are just experiencing a new strain at this point. So looking at the other pathogens, fungi can cause diseases such as candidiasis, vaginal yeast infection, athlete's foot, ringworm, jock itch, toenail fungus. Fungal diseases usually transmit via physical contact, skin-to-skin contact. Protozoans, they're microscopic, single-celled organisms, cause diseases like malaria and African sleeping sickness. Parasitic worms, they're like pinworms, tapeworms. They're more of a nuisance than a threat. Of special note are worm infestations that are associated with eating raw fish. I'm going to take my chances and continue to eat my sushi. Prions. They're self-replicating protein-based agents that can infect humans and other animals. One known prion is mad cow disease. Within the last decade, rates for many infectious diseases have increased. This can be partially attributed to a combination of economic development and land use, human behaviors, and the proliferation of international travel. There has also been a significant increase in vaccine-preventable diseases as some families opt out of vaccinations. Measles and mumps is the swelling of the salivary glands, which in severe cases can cause hearing loss and male sterility. Measles are, it's known for its high fever and itchy red rash. Cases of measles and mumps have been becoming increasingly common because people mistakenly believe that the diseases are gone and the risk of vaccination is greater than the risk of disease. So just because it's not happening Does it mean that the threat is gone? It means that that the vaccines are working, but now people are believing that the vaccines, we don't really need them and they're more harmful. So we're seeing a resurgence of some of these things. Other diseases that continue that we don't hear a lot about, but they're still there. West Nile virus. It's spread by the bite of an infected mosquito. Symptoms are flu-like, and can include a form of encephalitis. Today, only Alaska and Hawaii remain free of the disease within the United States. The best way to avoid infection is through eradicating mosquitoes. Wouldn't that be great? Wearing mosquito repellent, and avoiding mosquito-infested areas. We also have bird and pig flus. So avian influenza, avian bird flu is infectious disease in birds, and strains are capable of crossing the species barrier. It is zoonotic and can cause severe illnesses in humans who come in contact with bird droppings or fluids. So it's not the bird itself, it's the fluids from the bird or the bird feces. The virus has yet to mutate into a form highly infectious in humans, whereas the swine flu, H1N1, is a respiratory infection that was believed initially to be found primarily in pigs, but that eventually combined with a human flu virus. So it was a pig virus that combined with a human virus. Powassan virus is a virus related to West Nile, and it attacks the brain of those bitten, causing encephalitis. Infection can also occur when a tick is attached to the person for less than 1 hour. So mindfulness is actually a new ally, which is helping to bolster our defenses. And there's an emerging body of research that indicates that mindfulness may be a weapon in our arsenal against infectious and chronic diseases. So becoming much more mindful of how we are treating our bodies and taking care of ourselves. Every year, there are at least 20 million new cases of sexually transmitted infections, which are very preventable. Early symptoms of STIs are often mild and unrecognizable and go unreported. If they're left untreated, they can cause sterility, blindness, central nervous system destruction, disfigurement, and death. The more sexual partners that you have, the higher your risk for an STI. Casual attitudes towards sex in spite of an infection increase your risk, and ignorance about the infections and symptoms and how they're spread increases risk as well. STIs generally are spread by some form of intimate sexual contact. They have both pathogen-specific incubation periods and periods of communicability, times during which transmission is most likely. So there are times when an STI can be dormant and there's a less likelihood of spreading, but there's times when there's a greater communicability when there's like a flare in some of them. But even if you can't see the infection, if you have the infection, you can spread the infection. So chlamydia, in 2015, there were just over 1.5 million reported cases. Many people display no symptoms at all, but men may experience painful and difficult urination and a pus-like discharge from their penis. Women are more likely to be asymptomatic, not showing symptoms, but may show a yellowish discharge or spotting between periods, or occasional spotting after intercourse. Complications can lead to injury to the prostate gland, seminal vesicles, inflammatory damage to the vessels of the heart, and arthritic-like symptoms in men. In women, damage to the cervix or fallopian tubes can cause sterility and lead to pelvic inflammatory disease. Chlamydia may be responsible for one type of conjunctivitis, which is an eye infection. So down there affecting up here. If detected early, it is very easily treatable with gonorrhea. Is surpassed only by chlamydia. It's one of the most common bacterial STIs in the U.S. Nearly 400,000 new infections each year. Symptoms in men are white milky discharge and painful urination. Most women don't experience symptoms, but occasionally vaginal discharge and a burning sensation occur while urinating. Complications, if not treated, include scarring resulted in PID and sterility. May, through the blood, infect the joints, heart valves, or brain. It's possible to transmit it to a baby during delivery and a pregnancy. If detected early, it's treated with antibiotics, but it also has begun to develop resistance. Frequently, chlamydia and gonorrhea occur at the same time, but different antibiotics are needed to treat each one separately. Here's a look at what gonorrhea looks like. Not super awesome. Syphilis is generally transferred only through direct sexual contact or from mother to fetus. The incidence of syphilis is highest between adults aged 20 to 39. Syphilis is known as a great imitator because the symptoms often resemble other STIs. Sometimes there's no symptoms, but there are 4 stages. So primary, chancre develops, which is sores at the primary site, and those disappear in like 3 to 6 weeks. So sores develop with other STIs as well. Secondary, a rash or white patches appear on the skin or mucous membrane. Latent, it invades the organs and causes lesions called gumas. And tertiary, the late stage, heart and central nervous system damage, along with loss of senses and motor ability. It's easily treated with antibiotics, except in the late stage. So let's take a look at syphilis. As you can see, there are sores and lesions, even on the hands. So primary, secondary, and latent syphilis are shown here. Herpes is the general term for a family of diseases characterized by sores or eruptions on the skin. It's not transmitted exclusively by sexual contact. There's herpes simplex 2 and herpes simplex 1. 1 is typically about half the population, and it's cold sores on the mouth. The precursor to infection is characterized by a burning sensation and redness, so a burning or a tingling. The second phase, a blister filled with clear fluid that contains the virus forms, and then a blister will crust over, dry up, and disappear. But the virus remains in certain nerve cells for life. It doesn't go away. And it can flare up or cause symptoms when the body's ability to maintain itself is weakened. So when the immune system dips or stress is activated in the body, you can get a herpes flare if you have the virus. Many physicians recommend cesarean deliveries for women who are infected with herpes because it can pass on to the baby at birth. There is no cure for herpes. Certain drugs can be used to treat symptoms and reduce viral shedding. Here's a look at herpes, both genital and oral herpes. So there's over 150 different types of HPV, and people infected with low-risk HPV may develop genital warts. HPV can cause cervical cancer, cancer of the vulva, penis, anus, vagina, back of the throat, tongue. Dysplasia is a complication, which is a change in cells that may lead to precancerous condition. Treatment's only available for the low-risk forms of HPV. Most warts can be treated with topical medication or can be frozen. 2 vaccines have been licensed by the U.S. Food and Drug Administration or recommended by the Centers for Disease Control and Prevention for genital warts. There's a lovely photo of what it looks like, and this is a pretty mild condition. I've actually seen photos of it being a lot worse, but moving right along, candidiasis is also known as a yeast infection. It is caused by yeast-like fungus. Symptoms include severe itching, burning, swelling. Antifungal drugs can cure candidiasis in just a few days. Trichomoniasis is caused by a protozoan, and it can be spread sexually or by contact with items that have discharged fluid on them. Some signs and symptoms in women include foamy, yellowish, unpleasant smelling discharge, accompanied by a burning sensation, itching, or painful urination. Most men don't experience symptoms. It can be transmitted typically by sexual contact or toilet seats, wet towels, or other items with discharged fluids. Not all STIs are transmitted by toilet seats. They're typically not. This is one of the few that can be. Pubic lice, aka crabs, are small parasites usually transmitted during sexual contact. They attach themselves to the base of the pubic hair where they deposit their eggs, nits. Just like people get lice in their hair on the top of their head, you can get lice in your pubic area. 1 to 2 weeks later, after the eggs have been deposited, the nits develop into adults that lay eggs and migrate to other body parts. So yes, this one can move around on your body. Symptoms include itchiness in the area covered by pubic hair, bluish gray skin color in the pubic region, and sores in the genital areas. Diagnosed by identification of eggs in the genital area, and treatment includes washing clothing, all of the clothing, furniture, linens that may harbor eggs. It's usually transmitted sexually, but can also be caught from lying on sheets or sitting on a toilet seat that an infected person has used. Again, not many STIs are transmitted through toilet seat, but this is one of them. And there's a photo of that cute little fella just itching to grab a hold of you. And last, we're going to touch on HIV and AIDS. AIDS is acquired immunodeficiency syndrome, and it's caused by the human immunodeficiency virus, HIV. It was first recognized more than 37 years ago. And since its discovery, approximately 78 million people worldwide have become infected. Because of improved treatments, more people are living with HIV than ever before. So they're living with HIV and staying in that HIV range rather than going to the next level with AIDS. HIV is transmitted when an infected person's bodily fluids, blood, semen, vaginal secretions, etc., gain entry into another person's body through a breach in the body's defenses that we talked about earlier. Despite some myths, HIV is not highly contagious, right? You're not going to get it with being in close proximity with somebody that is infected. Engaging in high-risk behaviors is one of the ways that we contract HIV. So exchanging bodily fluids, contaminated needles. There's also mother-to-child perinatal transmission, which occurs. antibody testing. So there is they are accurate if window period has been long enough. So antibody test provides results from blood in 30 minutes. And the Aura Quick Test Kit can provide results within 20 minutes. So the home access HIV test system requires a fingerprint of blood to be sent to a lab. There are combo or fourth generation tests which look for antibodies and antigens, and there's a shorter window period. There's also a nucleic acid test and HIV P24 antigen test. They're quicker but not recommended for an initial screening. So there are a multitude of tests, and some of them you need to be tested in one area, and there's a progression before you get tested for the higher level tests. So there are new high-powered anti-HIV drugs that have slowed the progression of HIV to AIDS and have prolonged life expectancies for most AIDS patients. And while I say most, not all, because there's no treatment that is effective for all cases. Our best course of action is prevention. And we need to reduce our risk by making responsible choices and behaviors. And if you don't exchange bodily fluids, you're not going to get the disease. Abstinence or safe sexual practices are really the best bet. All right, guys, I will see you on Thursday. Get ready for some good conversation. Take care of you.